Did you know there's a type of high blood pressure that can't be measured with a cuff on your arm? It lurks deep inside your chest, silently putting strain on your heart. This condition is called pulmonary hypertension, and it's a serious threat that many people don't even know exists. It can make you feel constantly out of breath, tired, and dizzy. If you don't catch it in time, it can lead to a life-threatening condition called right heart failure, where your heart simply can't keep up. So today, we're going to dive deep into pulmonary hypertension. We'll uncover what causes it, how it affects your body, what symptoms to look out for, and most importantly, what you can do to manage and prevent it. Ready to understand your body better? Let's get started. To understand what goes wrong in pulmonary hypertension, let's first look at how things are supposed to work. Your heart has 4 chambers, and the right ventricle is the one responsible for pumping oxygen-poor blood into your lungs. Think of it as the first stop on a very important delivery route. Once in the lungs, this blood drops off carbon dioxide and picks up fresh oxygen. This newly oxygenated blood then travels back to the left side of your heart, ready to be sent out to nourish the rest of your body. This entire circuit through the lungs is naturally a low-pressure system. It's designed to be an easy, efficient trip, so your heart doesn't have to work too hard. But with pulmonary hypertension, the pressure inside the blood vessels of your lungs starts to climb. This forces the right side of your heart to pump much harder just to get the blood through. Over time, this constant strain causes the heart muscle to thicken and stretch, eventually weakening it until it can't pump effectively anymore. That's the moment this silent condition becomes a serious problem. In the early stages, you might not notice much. Maybe you get a little winded climbing the stairs or feel tired more often than usual. But as the pressure in your lungs builds, the symptoms become much more obvious. You might experience significant shortness of breath, even during light activities like walking. You could feel dizzy or even faint because your brain isn't getting enough oxygen. Some people feel a squeezing or pressure in their chest, a direct result of the heart being overworked. If the condition progresses to right heart failure, things get even more serious. You might notice your legs, ankles, and even your abdomen starting to swell up. This is because your weakened heart can't circulate blood properly, causing fluid to build up in your body's tissues. One of the biggest challenges with pulmonary hypertension is that these symptoms are easily mistaken for other common heart or lung issues. This often leads to a delayed diagnosis, allowing the condition to get worse before it's properly treated. So, what causes this dangerous rise in pressure? Doctors classify pulmonary hypertension into 5 main groups based on its cause, because knowing the origin is key to finding the right treatment. Group 1 is known as pulmonary arterial hypertension, or PAH. This is when the arteries in the lungs themselves become narrow, thick, or stiff. Sometimes, we don't know the exact cause. That's called idiopathic PAH. Other times, it can be inherited through genes or linked to other conditions like connective tissue diseases such as scleroderma and lupus, liver disease, or even certain toxins and drugs. Group 2 is pulmonary hypertension due to left heart disease. This is actually the most common cause. When the left side of your heart is weak or stiff, perhaps from long-term high blood pressure or a previous heart attack, it can't pump blood out to the body efficiently. This causes a traffic jam, with blood backing up into the lungs and increasing the pressure there. Group 3 is caused by lung diseases or a lack of oxygen, also known as hypoxia. Conditions like COPD, emphysema, or sleep apnea mean your body isn't getting enough oxygen. To compensate, the blood vessels in your lungs constrict to redirect blood to areas with more air. But if this happens all the time, this constriction becomes permanent, leading to high pressure. Group 4 is caused by chronic blood clots in the lungs, a condition called CTPH. After a pulmonary embolism, sometimes the clots don't dissolve completely. Instead, they turn into scar tissue that clogs the arteries, forcing the heart to work harder to push blood past the blockages. Finally, Group 5 is a catch-all category. This is where pulmonary hypertension is linked to a mix of other rare diseases or conditions that do not fit neatly into the other groups, like sarcoidosis or certain metabolic disorders. Identifying which group a patient falls into is the critical first step for doctors to create an effective treatment plan. Now, how do we tackle this condition? Treatment for pulmonary hypertension is not a one-size-fits-all approach. It really depends on the underlying cause we just discussed. For example, if it's caused by blood clots in group 4, doctors might prescribe anticoagulants or blood thinners to prevent new clots from forming. In some cases, surgery to remove the old clots might be an option. If low oxygen from a lung disease like COPD is the culprit, giving supplemental oxygen can help relax the blood vessels and ease the strain on the heart. But for group 1, the pulmonary arterial hypertension we talked about, the treatments are more specialized. Doctors use targeted therapies that work to open up the narrowed blood vessels in the lungs. These include drugs like endothelin receptor antagonists, prostacyclin analogs, and PDE5 inhibitors. These medications help lower the pressure in the lungs, allowing the heart to pump more easily. In the most severe cases, when the heart or lungs are too damaged to recover, a lung transplant or a heart-lung transplant might be the last resort. Beyond medical treatments, your daily habits play a huge role in managing pulmonary hypertension. Let's talk about some lifestyle changes that can make a real difference. First, listen to your body and avoid strenuous activities. Things like heavy lifting or climbing multiple flights of stairs can put too much stress on your heart. Instead, opt for gentle exercises like slow walking, yoga, or deep breathing exercises, which can improve your stamina without overdoing it. Your diet is also crucial. Cutting back on salt is a must, as too much sodium causes your body to hold onto fluid, which can lead to swelling and increase the workload on your heart. Focus on a diet rich in fresh vegetables, fruits, and lean proteins like omega-3 rich fish. Try to limit processed foods, which are often packed with hidden sodium and unhealthy fats. It goes without saying, but if you smoke, quitting is the single most important thing you can do. Smoking constricts your blood vessels and lowers your oxygen levels, the exact opposite of what you need. It's also wise to avoid alcohol and other stimulants, as they can interfere with your medications and cause an irregular heartbeat. And please, never self-medicate. Some common over-the-counter drugs, like certain cold medicines or even weight loss pills, can make pulmonary hypertension worse. Finally, be mindful of your environment. Long flights or travel to high-altitude places above 2,000 meters can be risky because the lower oxygen levels can trigger symptoms. And don't underestimate the power of rest. Managing stress and getting enough quality sleep helps keep your heart rate steady and your blood pressure down. Pulmonary hypertension is undoubtedly a serious and complex condition, but it's not a hopeless one. With early diagnosis, the right medical care, and a commitment to a healthier lifestyle, you can effectively manage the symptoms and continue to live a full and meaningful life for many years. The journey begins with knowledge. Understanding what's happening inside your body is the first and most powerful step toward taking control of your health. Thank you so much for joining me today. If you found this video helpful, please give it a thumbs up and share it with someone who might need to hear this. Don't forget to subscribe and hit that notification bell so you won't miss our next deep dive into understanding your body. Stay informed and stay healthy.